Hi, my name's Toby Mountjoy, and this is the Autism Show. Hi, so we're into episode 10, and today we're going to be finding out all about the challenges that parents face after they've received a diagnosis. This is obviously a very, very difficult time for parents and families. So I thought it'd be a great idea to speak to my good friend Marlena in California, who's a licensed marriage and family counselor. She also has many, many years of clinical experience working, supervising children with autism intervention programs in our agency at AP. Hi Marlena, how are you? It's so great that you could be with us today on the show.
I'm great, it's my pleasure.
So I thought it would be really wonderful today if you could share some of your experience, stories about counseling in particular, and about how families are affected. We've been talking to a lot of families on the show about their experiences in getting their children diagnosed, their first fears when they noticed their child was not developing maybe in the way that they expected. So it'd be really wonderful to get your perspective of your work with those families. So what do families talk to you? Like, how does it affect a family when they're starting to notice there are sort of some developmental differences with their child, and what's their sort of experiences and emotions and thoughts and experiences around that time?
I guess my experience is as varied as the spectrum is itself, because as you know, the spectrum is so diverse that we have so many different stories of how people come to dealing with the process of getting a diagnosis and changing treatment. One of the issues that typically comes up is maybe one partner is resistant to getting an assessment. Maybe one of the parents is observing a delay or having some behaviors of concern, and they would like to get some assistance in ruling in or ruling out anything. And maybe the other partner is like, no, everything's fine. You don't have to worry about it. You're making a big deal out of nothing. And that can be quite an issue for the family to navigate. Once someone has decided that they want to move forward with getting an assessment, it can be very frustrating to have to wait. And the nerves and the anxiety over what could be going on with my child, what do I need to do, is an issue that comes up frequently. Another topic that a lot of my clients bring up is guilt over missing things, not catching it early enough, not being able to obtain the proper treatment. Those kinds of situations can happen. And so those are some of the common issues that I've dealt with.
How about when the child has actually been diagnosed and maybe the parents have received a sort of more formal diagnosis? What sort of impact does that have on a family?
I think the number one topic that is brought up to me is fear of the future. And it's unique, I think, in autism in comparison to other areas of special needs in children, in that it's hard to tell where a child will end up in 5, 10, 15 years. The way they present when they're 3 could be very different than how they present when they're 20. And so families can often be quite concerned about not knowing what to predict, because we as professionals also cannot give them a straight answer for this is the trajectory of what you can expect. Because a lot of it depends on how the child matures, what treatment that we're able to provide, and the quality of that treatment, and how much the family is able to support the child through the treatment as well. So there's so many factors in how that's going to happen. So I think that's a very frustrating aspect for families, and human beings don't do well with ambivalence. Not having an answer of what I can expect can be extremely difficult to tolerate. Again, I think more ambivalence we have, the more stress is in the system, and the more stress is going on in the family, and they need additional support. And they also need us to say, you're experiencing this, and that's normal for someone in this situation, because we can't give you a straight answer, and it's extremely frustrating. But know that you can take it year by year, and we'll be there with you, to help support you through that, and we'll get there. Try not to think too far ahead, because things can change, and just know that we're going to do the best we can with each moment.
And what do you see as, over the, course of years, what do you feel like are some of the bigger challenges for parents parenting a child with autism, and I'm sure it's quite different, a different experience.
Feeling supported, having enough access to appropriate treatment, and having the strain of the financial worries is a big issue. And if there were things that we could do to help make effective treatment more accessible to a larger population, that would be a huge benefit for families. Reducing isolation, helping connect families with other families so that they can support each other and share their stories and their resources. When you have a child on the spectrum, sometimes you're not taking them out places or you're not visiting friends because there's behavioral concerns or that. And then we're more and more isolated and insular. So I think that's one of the things that we really want to work on is help bringing people into the community.
How does this whole process affect the relationships within a family, like a husband and wife and maybe grandparents, like that whole family unit?
I think it's something that we need to take a look at and help encourage those couples to know that while there is an increased stress in all different factors of life impacted by autism, there are a lot of ways to mitigate the stressors. For example, the decision making that takes place when you have a child on the spectrum, I think is definitely amplified. You're making decisions that, if it's 10 decisions for a neurotypical child, we have 100 decisions, whether it's every day navigating behaviors, navigating behavior plans, talking to each other about being consistent. That's probably one of the things that I navigate a lot is how we're responding to the child. Are we following through on the treatment protocols? How are we navigating life outside of treatment? Is someone being more lenient than the other? How do we support each other in that as opposed to having that cause us to go further apart? And so that's something that we deal with a lot is how do we let the challenge bring us together? There is a lot of research to support the idea that there can be a crisis that your family experiences, but that it can help push you into a more thriving situation. I have seen couples who have been able to get closer in their marriage and in their families, around this issue of supporting each other. But we have to practice effective communication and empathy for our partner, and a belief of everyone's doing the best they can. And let's start with that being the foundation, and let's build each other up from there. Let's build towards our strengths. If this person isn't good at towing the line, maybe let's not have them in that role. Let's give them a different role. Maybe they're great at getting your child to participate in sports. Then, let's figure out what role in the family each person can fit in that plays on their strengths, and then go from that kind of an encouraging standpoint. With regard to grandparents, I find that it's wonderful if you can have them involved. If they see things, sometimes culturally there's disagreement about getting a diagnosis, what a diagnosis means, should we be open about it, should it be secret? And that's something that we do definitely, I kind of have to be sensitive to when I'm working with different families. I work in a very culturally diverse community, so I take that into consideration when we're talking about how we share the diagnosis or the process of treatment. If someone can be supportive, then invite them in. But if you're finding there's a lot of judgment, then let's carve out a role for them, and maybe we keep a boundary so that you're not feeling undermined in your parenting or in your family life, and we can still keep the relationships going. Something I might want to mention is of siblings of children on the spectrum. There's research to support that when you have a child with autism in the family, those people, the siblings, are far more likely to go into helping professions. So you're more likely to see them in maybe a medical profession or practicing law in a situation to advocate for others, or maybe go into psychological services. And I think that there's something about having an experience of special needs in your family that can open people to being more empathic and actually enhance their ability to be a good life partner, to be a good friend, and to be someone that really contributes to the community tremendously.
What are some of the challenges that they experience when they have a brother or sister that's been diagnosed with autism?
One of the main things that come up is that they're a feeling that the family revolves around that child and everything else is ancillary, that their needs are pushed to the side because the child with a diagnosis is the primary person. And this is true for families of kids that maybe have a terminal illness, or other types of, medical needs. But you have it reported also when there's a diagnosis of autism, and it's a very, the more impacted the child is, the more you have this experience. Often what we did at our office to help mitigate that was to run a sibling support group where we just have them come together with other siblings that had brothers or sisters on the spectrum, and we made it a really fun and positive experience so that when they got invited to something, it was just for them, to focus on them, and they were able to connect with other people that understood what they were going through, and that was a really positive support that we were able to provide.
How about parents' relationships with their sort of friends? I noticed for some of the parents that we see here, they can be quite isolated, or they maybe mention that they haven't wanted to go out with the friends from before, or they may worry about how their child would behave if they're out at a restaurant, or does it isolate them a lot in some cases? And do you have recommendations or advice for parents who are feeling that way?
It's important to reach out and to know who you can share information with. It's okay to not talk about it with certain friends if you don't think they have the emotional maturity to be there for you. If you can find someone that has that emotional maturity to reach out, to open up to them, and to make time to be together, often that person wants to be there for you. So people hold back a lot. Again, trying to connect with other parents that maybe can relate, but also carving out time in your life where you're not thinking about autism. You're just like, I'm going to go out and have dinner with my friends, and we're not going to talk about kids at all. We're just going to be me again, which is a really important respite and something that I really think we undervalue and we don't recommend enough. Like if I were to make a recommendation for families, I would say it's important to prioritize your physical and mental health to help your whole family. That taking care of yourself physically by exercising and being active, we know that helps people mentally and as well emotionally. And if you have an opportunity to tap into anything in the community that you used to do that is not necessarily related to autism, please do that, because sometimes people get so absorbed that every minute of the day as a parent needs to be towards doing something for my child, that by the time they've been doing this, raising their child for 6, 7, 8 years, they've lost who they are. They feel depleted. They don't have any more reserves in the tanks. And so by continuing to do things that nourish you, whether it's getting out in nature or continuing a bit of a hobby, being active, that benefits the whole family. It's not a selfish thing, and it's an important thing for the long term of how we're going to navigate this.
Well, I thought that was a really fascinating chat today, Marlena. I want to thank you so much for all your super informative discussion around counseling. Thank you so much for your time today. It's been really great to have you.
Thank you very much. I enjoyed it.
Thanks a lot for watching today. I thought that was a brilliant insight from Marlena, and we'll see you next time to get a parent's perspective on their journey when they found out about the diagnosis.